Hello, my name is Claire Glenton from Western Norway University of Applied Sciences, and this is a short video presenting research results from the mHealth-Innovate project. The mHealth-Innovate project is led by Makerere University in Uganda and Western Norway University of Applied Sciences, and includes several other partners, including the World Health Organization. The aim of the project is to explore healthcare workers' informal use of mobile phones to support their work. Healthcare workers sometimes use mobile phones to carry out their work in ways that are not standardized, regulated, or officially endorsed. This usually involves using their own phones and airtime. They have no formal guidance, for instance, on how to store or how to share data, and they receive no compensation. And this is what we refer to as informal mobile phone use. This is not the same as healthcare workers who are given work phones, for instance by government or non-governmental organizations. It is also not the same as healthcare workers who use their own phones in ways that are formally endorsed, for instance through bring your own device schemes. When the mHealth-Innovate project explored this topic, we did this in two ways. First of all, we gathered all available research about healthcare workers' views and experiences of informal mobile phone use. We did this in a systematic review, where we analysed 30 qualitative studies from high, middle and low-income countries. These studies looked at the views and experiences of different types of healthcare workers working in different types of healthcare settings. Secondly, we carried out two qualitative studies in Uganda, where we gathered data about the views and experiences of healthcare workers, but also of policymakers and program managers. So what did we find? Well, we found a lot of issues that were similar across several different countries and settings. Some of these findings were only supported by small amounts of data, though, and we downgraded our confidence in these findings from high to moderate. And we've indicated this in the findings I'll present now. Let's begin by discussing what healthcare workers are using their mobile phones informally for. Healthcare workers are using their phones informally to communicate with colleagues. They're seeking advice and support, for instance, when making referrals or during emergencies. They're also overseeing and managing other healthcare workers, sending reports and sharing practical information. They're also retrieving and recording and storing patient information. They're taking photos, for instance, of X-rays and test results and schedules. And they're searching for information online. And they're also using their own phones to communicate with patients, at least in some low and middle income countries. So why are healthcare workers using mobile phones informally? First of all, they're doing this because of gaps in the healthcare system, including poor formal communication systems. This informal use of mobile phones has also become a normal part of work for many healthcare workers, and they may feel pressure or expectations to use their own phones when formal systems aren't working. And they're also doing this because of feelings of obligation to colleagues and to patients who they want to support when formal systems aren't working. So what do healthcare workers think the benefits and the harms are of informal mobile phone use? Healthcare workers describe how this informal behaviour makes it easier and faster to communicate with colleagues and patients, which ultimately leads to better quality care. Some healthcare workers, particularly in low and middle income country settings, also describe how they exchange personal phone numbers with patients. And this gives patients access to individual healthcare workers rather than just generic systems. But healthcare workers also describe how informal use can blur the boundaries between work and personal life, as they're always on call. While they're at work, it can help healthcare workers stay connected to home. But some people are also concerned that it leads to distractions at work because of social media use or calls from family members, but also calls from colleagues. Many healthcare workers are concerned about patient privacy and confidentiality when patient information is stored and shared on personal phones. But some also describe how informal phone use can offer more privacy than the formal system. For instance, some patients might prefer to discuss sensitive topics on private phones rather than at clinics, or might not want this information recorded in patient journals. Informal mobile phone use has cost implications, including the costs of the phone, data, airtime, and electricity. For some healthcare workers, particularly in low and middle income countries, these costs are a significant financial burden, and these healthcare workers call for some form of compensation. Some healthcare workers are also concerned about possible legal implications. For example, when healthcare workers offer advice to patients and colleagues through informal channels. Storing and sharing of information on personal phones and through informal channels such as informal WhatsApp groups can also undermine the formal system and cause problems for patient care. For example, patient journals may lack important information when patients are referred on. Informal approaches could also increase inequities among healthcare workers, particularly for those at lower levels of the system and in low resource settings. For instance, informal costs are likely to be a bigger burden on these healthcare workers. And they're also less likely to have strong personal networks to call on for help and advice. And finally, informal approaches could increase inequities among patients if healthcare workers choose to use their personal phones and airtime on some patients, but not others. So how is healthcare workers' personal mobile phone use at work currently regulated? Healthcare workers often don't know if policies or guidelines regulating the use of their phones in the workplace exist. Where they are aware of them, they sometimes perceive them as unclear, unrealistic, and difficult to enforce. So, what is the way forward for healthcare workers' informal use of mobile phones? In the studies we examined, several researchers, healthcare workers, and policymakers argued that the advantages of personal phone use outweigh the disadvantages, that a total ban was unrealistic and would be difficult to impose, and that personal phone use should instead be harnessed. They suggest that future strategies should be based around the continued use of personal mobile phones and should focus on ways in which to maximize the benefits while minimizing the disadvantages. The best way to deal with informal mobile phone use is currently being discussed in a series of dialogue meetings. These meetings are being hosted by the Ugandan Ministry of Health, the World Health Organization's Eastern Mediterranean Regional Office, WHO Headquarters, and HIFA, Health Information for All. This video was based on a Cochrane review that was published in 2024 and on 2 studies from Uganda that are currently being prepared for publication. The mHealth-Innovate project is funded by the Norwegian Research Council. Thanks for listening.